Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Today we're going to discuss the initial feeding methods in case of the LBW. So what is the LBW? LBW is nothing but the low birth weight. So under this LBW, we are characterizing the age group as less than 28 weeks. So in this less than 28 weeks, there is no proper sucking effort and there is no propulsive motility of the gut. And the feeding of method is going to be IV fluids. Next, moving on to another category, that is 28 to 31 weeks. So this 28 to 31 weeks is where the suckling burst it develops. So you have presence of sucking bursts. It develops and there's no coordination between the suck, swallowing and also the breathing. So what will be the method of feeding? The method of feeding here is going to be by orogastric or the NG, that is a nasogastric feeding, with occasional spoon or the PLAB feeding. So you can also use a spoon or the PLAB feeding. So we saw less than 28 weeks and 28 to 31 weeks. Next, moving on, we look at the 32 weeks, 32 to 34 weeks. So here in 32 to 34 weeks, the suckling pattern, it begins to mature. So there's a suckling pattern, this matures. Next, the coordination between the breathing and the swallowing begins. So there's also presence of the coordination which begins, that is between the breathing as well as the swallowing. Then moving on to the method of feeding, the feeding is by the spoon. So the feed is by the spoon or the PLAB or the cup. Lastly, we move on to a group that is greater than 34 weeks. So from greater than 34 weeks, the mature sucking pattern is present. So there's a very mature sucking which is seen, and better coordination between the breathing and the swallowing. So the coordination is good. So what is the method of feeding here? The method of feeding here will be the breastfeeding.